Tina, can you comment on how your chronic pancreatitis has been treated? And I'm talking here about the outpatient. What do you do in the real life when you are doing what you do every day?
Well, pretty much, I'll eat anything. I'll try it, and if I can't tolerate it, then I just stay away from it. If I'm not feeling well, you know, I'll just stick to like yogurt and stuff that's pretty easy, because they say, you know, if you're in pain, the best thing to do is stay away from food and drinking, and I can't stay away from food. And I go to the gym, and I just take it easy if I'm doing good one day. You know, I don't overdo it, because if I do, I'm hurting for a couple days. So when I go, you know, even if I'm just there for a half hour and do a little bit, but it's nice to be able to get out and go to the gym, because I wouldn't have been able to do that in the last couple of years. So I just started being able to do that stuff now.
You know, you're being careful also in the amount of fat that you eat with each meal.
Yes.
And you're trying to also keep well hydrated most of the time.
Yeah.
Wendy, can you comment also on how was your chronic pancreatitis treated? You were mentioning that they went to the extreme to recommend taking the pancreas out. Can you comment how this process was?
I couldn't function, and the pain was so, so bad that Dr. Gardner finally had me see a surgeon, and at this point I was, again, losing weight. So he had me go see Dr. Smith, one of the surgeons at the hospital, and we talked about having a Whipple, which scared me to death because I knew nothing about it, didn't know the severity of it. So I did have the Whipple. Then I ended up having pancreatitis come back a few months later, ended up having another feeding tube, ended up losing more weight. Again, went and saw Dr. Smith. He then suggested, when we found out that I ended up with what's called IPMN, which is a precancer in my pancreas, he decided at that point, we're taking the whole pancreas. So I ended up having, 5 months later, having another surgery where they removed the total pancreas. And again, then I became a diabetic at that point.